My name's David Martin. I'm the Executive Director at the American Board of Orthopedic Surgery. I'm joined tonight by Michael Bednar, who is the Associate Executive Director at the American Board of Orthopedic Surgery. David Elstein, Denise Frazier, and Kristen Kaba are also joining us from our staff at the American Board of Orthopedic Surgery in Chapel Hill, North Carolina. And again, what we'll talk about is how you can participate in continuing certification or maintenance of certification. So first, I'd like to just talk about the mission at the American Board of Orthopedic Surgery. Our mission is to ensure safe, ethical, and effective practice of orthopedic surgery. We do that by maintaining the highest standards for education, practice, and conduct with examination, certification, and maintenance of certification programs. And we do what we do for the benefit of the public. Our vision and our values are also depicted here, and you can review those on our website. I'd like to cover one important guiding principle that we come back to over and over at the American Board of Orthopedic Surgery, and that's shown here. We believe that there is no place for bias or discrimination within the field of orthopedic surgery or within our organization. I'd also like to introduce you to our board of directors. Our board of directors is made up of 20 orthopedic surgeons, practicing orthopedic surgeons from across the country. We also have one public member, and I show this to you to let you know that as orthopedic surgeons, they go through the same continuing certification processes as you and I, and their initial certification dates and recertification dates are listed here, along with several board members who hold subspecialty certification in either sports medicine or surgery of the hand. By way of an overview of the webinar, what we'll cover tonight is first, the continuing certification requirements. Second, we'll talk about the professional standing update, our application for maintenance of certification or continuing certification. We'll talk about the nuts and bolts of that application. We'll also talk about how you can complete a knowledge assessment. And finally, we'll have time to answer questions at the end of the webinar. And if you'll raise your hand in Zoom, we will call on you. You'll be unmuted. You can ask your question. And once we answer the question, if you can please lower your hand, then we can go through the questions as they come up. So first, let's talk about the continuing certification program, or as you may recall, a maintenance of certification program at the American Board of Orthopedic Surgery. We function on a 10-year cycle, and there are 4 parts of that program. The first is professional standing. We measure that by an individual having an unrestricted state medical license and hospital admitting and surgical privileges. We also look at continuing medical education, and the requirement is 240 Category 1 CME credits over 10 years, of which 40 need to be self-assessment examination credits. And what we have recently done is divide those credits in half, so that an orthopedic surgeon needs to earn half of those in the first 5 years and half of those in the second 5 years to spread out that education over the 10-year cycle. And we do make a decision at that 5-year point. There's also a knowledge assessment. We'll go through the multiple options an individual has to complete a knowledge assessment during the 10-year cycle. And finally, we look at practice improvement. And the way we do that is with a professional standing update, which involves us obtaining information to do a peer review process and also obtaining a case list. I would encourage you to go to our website and look for your continuing certification timeline. This is mine. My certificate expires in 2031, and you can see the parts are listed there, color-coded. So across the top in green is the continuing medical education credits. That's 120 and 20 in the first 5 years and 120 and 20 in the second 5 years. And we've just passed that first 5-year period. We've entered that year 5. So at the end of this year, I'll need to meet that 120 and 20. Going down from that in the purple block, you'll see that's the professional standing update, the application, and case list. That needs to be submitted by December 1 of year 9. It can be submitted, as you can see there, in either year 7, 8, or 9, so either in 2028, 29, or 2030. If it's not submitted in 2030, then my certification will expire. And finally, the bottom three blocks in the blue-green show the three knowledge assessment options. A general or practice profile computer examination can be taken in years 5 through 10, an oral examination in years 8, 9, or 10. And then finally, the web-based longitudinal assessment, ABOS WLA program, that can be done in the first 8 years of the cycle, and an individual needs 5 quality years in those first 8 years. So I'd encourage you to go to our website. We have a timeline just like this for each certification expiration year. So let's talk about first the CME. We have given individuals more time to meet the requirements to be participating in maintenance of certification or continuing certification. So an individual needs 240 CME credits, category 1, by the end of year 10, 40 of which need to be scored and recorded self-assessment examinations. And those need to be divided into 2 aliquots, 120 and 20 in the first 5 years and 120 and 20 in the second 5 years. And please note that obtaining more in the first 5 years, those do not roll over and count towards the second 5 years. You need 120 and 20 in each 5-year portion of your cycle. I would say that 120 over 5 years is right around a little bit less, in some cases a little bit more than most state CME requirements for medical licensure. As far as the CME goes, we count only orthopedic related category 1 CME, and we have acceptable activities listed on our website. We have 80 plus participating CME providers across the country that automatically transfer credits through the ACCME to our system. So you no longer have to upload the documents for that CME from, again, those 80 plus providers. Many hospitals, my hospital automatically transfers my CME credits for grand rounds right to the ABOS. Other orthopedic organizations and hospitals are joining soon. And if you get CME at an institution that doesn't upload automatically, I would encourage you to have that institution get in touch with the ACCME to arrange that, or you can call our office and we'll try and help with that as well. If you participate in the AAOS online learning portfolio, those credits are automatically transferred, or you can get CME certificates and upload those through your dashboard. One reminder in the lower right, we are not a repository for you to store CME credits. So once we get to 120 and 20 in the first 5 years and in the second 5 years, we stop counting. So you need to save your CME transcripts if you'll need those for other activities. As far as the case list, when you submit a case list, in the same year that you're planning to do the application or the professional standing update, we want you to enter all surgical cases from January 1 through September 30th. So you start earning cases in which you were the primary surgeon on January 1. If you get to 75 cases, you can stop. If you don't get to 75 cases, continue through September 30th. We don't want you to enter cases where you're a co-surgeon or assistant surgeon. Only those cases where you're the primary surgeon, where you dictated the operative note and followed the patient preoperatively and postoperatively. There's a list of procedures not to include on that case list. That's found on our website. And when you enter the medical record number, it's the hospital or surgery center medical record number. If they don't assign that until the time of the surgery, you can use your chart number and then change that over once a medical record number is available. Again, that's submitted in year 7, 8, or 9 with the professional standing update, the application. The 35 to 75 is a number I wanted to talk about. So you start January 1, you can stop at 75 cases. If you don't get to 75, you submit all cases through September 30th. If you have 35 or more and less than 75, you'll stop at 75. So there's no need to input more cases in 75. If you have more than 35, you may choose the knowledge assessment of your choice, either an oral exam, computer-based, or the longitudinal assessment, the ABOS WLA program. Let's talk about if you have fewer than 35 cases between January 1 and September 30th. If that's the case, the first thing you want to do is call our office. We will then adjust your case list so you can submit cases for the last 3 months of the previous year. So that gives you a full year of cases. If you reach 35 in that full year from September 1 of the year before to from October 1 through September 30, then you can again go to the knowledge assessment of your choice. If you don't reach 35, you're classified as low volume. That's not a problem. I'm in that category. Not a problem. But your case list will then be reviewed by our credentials committee. And what we will have you do is count backwards till you get to 35 cases. We feel like if an orthopedic surgeon is in an active surgical practice, we ought to look at a volume of cases. And what our board has decided upon is 35 cases. So you'll count backwards to get to 35, and it's fine if that takes a longer time. And then that case list is reviewed by our credentials committee, and most of the time those individuals are then allowed to participate in the knowledge assessment of their choice. If things about that case list don't make sense, then we gather more information and may guide someone towards a particular knowledge assessment. If you no longer perform surgeries, then you need to contact your certification specialist, and we'll let you know how to do that at the end of the talk. So hopefully we can put you in a non-operative or non-practicing pathway. This is what the case list entry system looks like. You do patient initials. Again, the patient ID, their age, their gender, the hospital or surgery center, and you enter those, and then they appear on a drop down. The date of surgery, your date of last follow-up, ICD 9 and 10, treatment codes, the CPT codes. There's an anatomic region with a drop-down menu. Finally, that description of operation. We don't need a whole lot of history in that box, just left total hip arthroplasty, right knee ACL reconstruction, left carpal tunnel release, open reduction, internal fixation of a distal radius fracture. We don't need a whole paragraph there. We just need a brief description of the case. That's the information that is requested on the case list. So why do we do a case list? Why should we collect a case list? First of all, we feel like it's important to assess a diplomate's practice. When we look at a diplomate, if I look at our overall program, if we look at their professional standing, hospital privileges license, make sure they're doing CME, keeping up with their education, some sort of knowledge assessment, and then finally, I'd like to look at their cases and do some peer review. We think that's a pretty good look at an orthopedic surgeon so that we can recertify that person. So we use that to assess practice. It's an opportunity as an individual fills out a case list for self-evaluation of their performance in practice. If you go through 75 cases and look at the follow-up and go through those cases, that can be a learning opportunity. Finally, we do give a case list feedback report. This is a sample of one here. So that's me from January to June of 24, 75 cases. You can see the top ICD codes, the top CPT codes, and then that compares my case list to all the other sports medicine individuals in that year. It also compares me to all the individuals who put in cases. So you can see that when we look at all the individuals, that's over 500,000 cases and like 7,000 surgeons. But it shows the common CPT codes, the average age, and various things. And there's a number of pages on that report to help a person sort of evaluate their practice. And finally, if an individual either elects to take an oral examination or our credentials committee decides that an oral examination may be the best thing, that those cases form the basis for that examination. The professional standing update, again, that's submitted in year 7, 8, or 9. 9 is bolded there because if year 9 goes by and you don't submit a professional standing update, your board certification will expire the following year. That's a firm deadline at year 9, and you'll expire. And then there's a re-entry pathway, but that involves an oral exam. So really encourage you to get that in starting in year 7 if you can, but you can do it in 8 or 9. It's due December 1 by 4 p.m. Of this year. It will be available in March to start that process with the case list and the professional standing update. Some notes, the professional standing update, again, year 7, 8, or 9. it asks for your practice location with partner names and emails, the hospitals and surgery centers where you have admitting and surgical privileges, and we need the most recent reappointment letter. Not your original appointment letter, but your most recent appointment letter. And then we'll ask for the names and emails of the chiefs of staff, the chief of surgery, the chief of orthopedics. You'll need your state medical licenses with the dates of expiration and the license numbers. And then finally, you'll select 5 ABOS diplomates from a drop-down menu who are familiar with your practice for us to also obtain peer review from that group as well. As far as peer review, we do a comprehensive peer review process. We feel it's important to credential individuals to sit for our examinations or to go through and continue to be recertified. It's an electronically accessed survey, so we use those emails from the application, send that survey out. It contains questions about patient care, surgical skills, professionalism, and communication. There's an area for comments. And we also not only use those names and email addresses from the application, but we also take a zip code list of diplomates and do concentric circles around an individual's practice to really get a 360 peer review for each individual as they recertify. From the standpoint of the knowledge assessments, that's the third part of that, the knowledge assessment. There are 3 options: a computer examination. You can register for that through your dashboard between January and October. There's the oral examination. That has to be done in years 8, 9, or 10 after you've submitted the professional standing update and case list, and you start registering for that in January of the year that you're going to take the exam. And then finally, the ABOS web-based longitudinal assessment program. That's done on a year-over-year basis, and that registration starts when you answer the first question. The fees, the professional standing update, if that's submitted by December 1, is $13.75. That's the case list and the professional standing update are submitted at the same time. You do have till the end of year 10 to complete your CME. We do have a 2-week grace period with a late fee by December 15th of $750. We have left those dates, December 1 and December 15th. They sometimes occur on weekends or on different days of the week, but those, we just want to keep those year over year. December 1 and December 15th are the days, the early deadline and then the late deadline. And then the assessment fees for the knowledge assessments, they're submitted before you sit for the examination, whether it be a computer examination or an oral examination, and the range of those fees are listed there. The years when you do the ABOS WLA program, those are submitted on a yearly basis. And we do have a maximum fee for each 10-year cycle so that you can move back and forth between the knowledge assessments without running up a large bill. So there is a maximum fee so that we don't keep collecting fees for all of those different knowledge assessments. If you have subspecialty certification in either surgery of the hand or orthopedic sports medicine, you do the same professional standing update, the same case list. You can recertify both those certificates with one knowledge assessment, either a computer-based recertification examination. Now that has to be surgery of the hand or sports medicine, and that's offered in alternate years. I'll cover that in just a few minutes. You can take the combined oral examination, or you can still do the web-based longitudinal assessment, and that just will require you to select 5 knowledge sources in each year in your subspecialty area. If you don't have subspecialty certification and are interested in perhaps earning that subspecialty certification, contact your certification specialist because you may be able to add that with just one examination as you recertify. The practice profiled examinations, they're computer-based examinations. They're in 10 different subject areas I'll cover in just a minute. They're only questions from that particular subspecialty. The surgery of the hand examination has only surgery of the hand questions. The orthopedic sports medicine, only sports medicine questions. Likewise with the other practice profiled examinations. You can take that in years 5 through 10, so you do not have to submit the professional standing update and case list before you take that examination. You should have 3 opportunities to take the examination of your choice if you start in year 5. The examinations are offered every other year, so that's 5, 7, 9, or 6, 8, 10, and I'll show you that in a second. The expiration date your certification expiration date can be found on your dashboard. They're offered in alternate years, and some of those are phasing out, and we'll cover that on this slide. So this is the schedule. You can see the 10 examinations along the left side of the screen. General orthopedic surgery, we offer that every year. That will be offered every year and will continue. The ones at the top, the top 5 there, foot and ankle surgery, trauma, pediatric orthopedic, shoulder and elbow surgery of the hand, are offered in odd years, 27, 29, 31. You can see that foot and ankle surgery, trauma, pediatric orthopedic surgery, and shoulder and elbow surgery, those examinations will be phased out and they will go away after 2031. So if you're interested in taking one of those computer-based examinations, I'd encourage you to get in before 2031. We found that not enough people were taking those examinations each year as we launched the longitudinal assessment examination program. And so consequently, we just don't have enough people taking those to set reasonable passing standards. The 4 examinations on the lower half of this screen: surgery of the spine, adult reconstruction, orthopedic sports medicine, musculoskeletal oncology, are offered in even years, 26, 28, 30, 32. Spine, adult reconstruction, sports medicine will remain on an every other year basis. You can see spine shifts actually in 2033. Musculoskeletal oncology, again, not enough individuals were taking that examination, so that will be phased out after 2030. So the process for a computer-based examination: you'll register on your dashboard for the examination between January and October. You'll submit the examination fee and schedule your examination through your dashboard. You'll take the examination at a Pearson VUE testing center between August and October, and you need to schedule it during that time period. In December, then you'll receive an email letting you know that the results have been posted on your dashboard. Along the line, then if you can take that examination, pass that examination, you still have to submit the professional standing update, case list, and fee by December 1 of year 9. We will then obtain peer review and review your case list. You'll submit the CME by the end of your 10th year, and that will then recertify your board certification certificate. As far as a computer-based examination, we have blueprints on our website that look like this pictured here for each of the examinations. And for instance, this is adult reconstruction. You see the large categories there: 40% hip, 40% knee, 10% perioperative management, and 10% general principles. And then each of those categories has further division, so you can see just what will be on the examination. There's information about the block timing there, and there's a tutorial all on our website under the Diplomates tab. I'd encourage you, if you're going to take one of these examinations, to utilize the tutorial so you don't have to do that at the testing center. As far as the test day policies and procedures, this is critical as well. They're posted in April to your dashboard. You have to attest to understanding those policies, and you need to review those carefully. There are 2 documents. One is the ABOS policies for that examination, and one is Pearson policies for that examination. Read those carefully. A couple points: cell phones have to be turned off and stored in a locker and cannot be accessed during the examination, even when you're on a break. You cannot bring study materials with you to the testing center, and you're not allowed to look at those even when you're on a break. So don't bring any of those materials to the testing center. All that's covered in those instructions, but I encourage you to review those carefully. And the blueprints can be very helpful, and the timing of the examination will be helpful as well. For the oral examination, the first thing you need to do there is submit the professional standing update in the case list by December 1 of year 9. You can do it in year 7 or 8. We will then obtain peer review and review the case list. From the case list, the credentials committee will review that case list and your professional standing update. And if you're accepted to sit for the examination, then 12 cases are chosen from that case list, and you'll present those at the time of the examination. And once you receive those cases and upload the materials, you'll pay the assessment fee at that time. You'll take that examination in July. We do have an alternate date in October for people with life events. And in September, if you take the examination in July, you'll receive an email letting you know results have been posted to your dashboard. If you move to the alternate date because of a life event, the results are posted then in November, actually early December. And you'll still have to submit the CME by the end of year 10 if you hadn't done so up until that point. From the standpoint of preparing for the oral examination, we have a number of videos on our website. The scoring rubric is on our website. If you elect the oral exam, you really need to review the scoring rubric. Each case is evaluated exactly based on the scoring rubric. You'll upload documentation about your cases. Those documents they're outlined on the website, what's uploaded, but I would encourage you to upload that documentation yourself, upload it early, upload the images that you would want to present, and practice those presentations. Again, you're presenting your own cases, so you want to practice those cases with the scoring rubric in hand and know the categories of the scoring rubric so you'll know how that examination is scored. Data gathering, diagnosis, interpretive skills, treatment plan, indications, technical skill, knowledge. So you look at those. That scoring rubric's available. It can be downloaded on our website, and really practicing those presentations is critical. From the standpoint of the ABOS web-based longitudinal assessment, eligibility for that, you can review those requirements for your certification's expiration year on the website. So if your certificate expires in 2031 or earlier, you must have already started because you have to get 5 quality years by year 8. If your expiration date is 2032, you must have started in 2026 if you haven't already. If your expiration date is 2033 to 2035, go ahead and start because you have 8 years to get 5 quality years. If you have a 2036 expiration date, you begin next year, 2037, you start the year after that. The earlier you start these things, the more chances you have to get these knowledge assessments behind you, get the professional standing update and the case list behind you. We allow 3 years because of life events. So when someone comes to us and says, wow, I'm in year 9 and I had a life event, I can't submit these things. The question we ask is, why did you not submit in year 7 or 8? And so please try and get these things in early. That's the best way to get this done. As far as the eligibility, if you hold a subspecialty certificate in surgeon hand or orthopedic sports medicine or both, you can recertify your general and subspecialty certificates with the web-based longitudinal assessment program, the WLA program, by choosing 5 knowledge sources in that subspecialty each year. If you're non-operative or non-practicing, you may participate in the ABOS WLA program, and you can contact your certification specialist to do that. There's not a requirement to participate in the ABOS WLA pathway. That pathway is not required. You can still do a computer-based examination, still do an oral recertification examination if you would like. There's a choice. There's no requirement to participate in the ABOS WLA pathway. An overview of that pathway, on January 9th of this year, we posted 223 knowledge sources to the ABOS WLA portal, and that's available through your Diplomate dashboard. There are 111 new knowledge sources and 112 that have been carried over from the last 2 years. If you would like to participate in that, you choose 15 of those knowledge sources, and you can do that now to study in depth. Most of the knowledge sources are journal articles. There can be practice guidelines or utilization criteria. On April 9th, at 9 a.m., the window will open for you to start answering questions about those 15 knowledge sources. You get 3 questions for each knowledge source. There are 30 multiple choice questions, 2 from each knowledge source that you chose. You will find out in advance what knowledge source the questions come from, so you can practice on that site. There are some sample questions there, but it will say, this is the knowledge source we're going to ask you questions from. Are you ready for 2 questions from that knowledge source? You say yes. It'll give you 2 questions. You have 3 minutes per question. It's an open book examination. You can answer 1 question in a sitting. You can answer all 30 in one sitting. It's an open book format. The window closes at 6 p.m. on May 22nd. So if you're not finished at 6 p.m. on May 22nd, the window closes. So you really want to try and get finished by then. Make sure you're in a place that has a secure connection to the internet. Those types of things. It's very hard for us to be responsible if you're in an airplane trying to do this. The successful completion metric is 5 quality years by the end of year 8 of the 10-year cycle. A quality year is answering 24 out of those 30 questions successfully. I would tell you that in 2025, more than 99% of participants were able to earn a quality year. We are really careful about reviewing the questions that are asked in that pathway, and hopefully you'll find those very straightforward. So important dates on that pathway. Again, January 9th, the knowledge sources are posted. You can start to look at those and pick out 15. On April 3rd, the assessment window opens. You can start answering questions. You finalize your 15 knowledge sources, pay the fee, and then you start answering questions. All 30 questions need to be answered by the deadline, 6 p.m. on May 22nd. If you haven't answered a question by 6 p.m. on May 22nd, it'll be scored as incorrect. We do have accommodations, and those are available on our website. There's an alternate date for the oral examination in October if you have a life event that coincides with the July date of the oral examination. And we have accommodations for the computer examinations as well. Each diplomate of the American Board of Orthopedic Surgery has a certification specialist. They are assigned based on the first letter of your last name. These people are there to help you. They're listed here. Denise Frazier is with us tonight. A and B, C through G is Sonia Parker. H through O is Kim Grover. And P through Z is Morgan Graham. Please don't hesitate to avail yourself of them as a resource. They are there to help you. We communicate by email. We have polled diplomates several times and found that email is the preferred source of communication. And so please keep your email up to date. Don't be like the Tyrannosaurus Rex and miss the arc taken off. Keep your email up to date on our website. And if you get an email from the American Board of Orthopedic Surgery, it is meant specifically for you. We do not send blanket emails out to all diplomates. Hey, all diplomates, the December 1 deadline is coming. Now, we look carefully at when your certification expires, where you are in the cycle, and send pointed emails to each individual. So if there's an email from the ABOS, please look at it carefully. We are active on social media in those areas listed on the right. We also have a patient-facing website called mycertifiedorthopedicsurgeon.org. I would encourage you to give that to your patients. That will tell your patients what you go through to become board certified. There are patient videos there. There are videos that explain what board certification means. It would be very valuable for your patients to look at that. mycertifiedorthopedicsurgeon.org. We also have a podcast. The host of the podcast is with us tonight, David Elstein. I would encourage you to go there at anchor.fm/ABOS or wherever you obtain your podcast. There are informational podcasts from people who have participated in each of those knowledge assessments and give information about how they navigated through that process, about how they navigated the case list. There are also podcasts from orthopedic leaders who talk about their careers. So I would really encourage you to take a look at that. There's very valuable information there. That is the formal presentation that we have. If you raise your hand in Zoom, we'll call on you. We have also recorded this webinar and it will be posted on our website, YouTube, and on our podcast. We'll have an audio only version. So we thank you for your attention. Dr. Bednar and I are available to answer your questions, as are David Elstein, Denise Frazier, and Kristen Kaba. These are the experts who help put these programs together. So if you'll raise your hand, we'll answer your questions, and I will stop sharing so we can get a little bigger picture. And I will call on the first person will be Dr. Gill.
Thanks a lot, Dr. Martin, for your talk. If I want to take the spine exam and I enter my cases this year, can I sit for it this year since 2026 is the spine exam year?
So I'm running back to, yes, the spine is one of the even exams. So are you in year 5 or greater?
Greater.
Yes, then yes, you could.
So I think I'm year 8 now, or 9, 8 or 9. I don't even know.
I'm looking for Denise to nod and say, yes, you could take the exam this year.
What's your first name, Dr. Gill?
Sanjit.
Okay, I just wanted to make sure I have the right person.
Yeah, I know. There's a bunch of.
Yes, you can take the exam. Your certificate ends in 27.
Okay, so I got to get my cases in, and then later this year I'll sit and take the exam.
Correct.
Yes.
All right, I better get cracking.
Yes, because by 28 you will have expired. So you want to take that this year.
Yes,
The
sir. Got it.
registration's already on your dashboard under part 3.
All right, yeah, got it. I got all my CME, so I think I'll get rocking and rolling. Thanks, guys. I
Yep.
appreciate the talk. I'm gonna sign off. Thank you.
All right,
You're
take
welcome.
care.
Dr.
Now-
Gill, you don't have to submit your cases before you can register for the exam, so you can proceed with that.
Okay, so maybe I'll do that this weekend. And
Sure.
registering for the exam just means to pay the fee and yada yada yada.
For now, all you'll do is just choose which exam you want to take, which sounds like the spine. And
Yeah.
then in late April, you'll receive a notification from us letting you know that you can schedule your exam at a Pearson VUE testing center close to you, and you would pay your fee at that time.
Okay. I live up in the mountains. I bet I'll have to go to Denver for a testing center, would be my guess.
They have many.
Yeah.
Okay. Let us know if you have trouble.
Thanks, guys. I appreciate it.
Thank you. Take care.
You too.
Dr. Mararchi. Hope I'm pronouncing that right.
Hi there, Adam Mararki here. You guys hear me okay?
Right. Yes.
Yeah, okay, great. So I'm going to take my well, I guess I'm in year 7. Everything's going great. My one question is about the web-based longitudinal assessment. Those questions qualify for, correct me if I'm wrong, they qualify for CME. However, they do not qualify for SAE. And my question is why? Because they are the definition of scored assessments.
So that's a good question. We've had that question before. And it's the CME is assigned through the Academy. The ABOS is not a CME granting organization. And thus far, the Academy has not felt that the length of that exam met the requirements for self-assessment examination credit.
Is there a minimum for self-assessment credit, and why is that a thing?
Well, generally it's either 10 or 20 CME credits for self-assessment examination. So it's that's something that we have considered and talked to the Academy, and we'll continue to do that. But for right now, it does not count as self-assessment examination
Yeah,
credit.
that's I would encourage if you have any way of putting any pressure on the Academy to give that feedback, because they are expensive and they are by definition self-assessment. and they're required. So if it's possible to kill two birds with one stone and minimize the cost and expense, because SAE is expensive, right? When you're getting into the self-assessments, that's a significant cost, and it would be a consideration to those who have to go through it to not have to pay twice for that. Yeah.
Sure. And that's something we'll take back. We can
Yeah.
take back to our committee and the academy as well.
Okay. Well, thank you. Great talk, by the way. Great.
Thank you.
Presentations.
Dr. Jadov.
Question. I heard about somebody asking about the spine exam that he has to register. If I've already done the WLA, have the 5 years, then do I need to register or just submit my case list and peer review references?
No, you would not. If you have completed, you need to just complete one of the knowledge assessments. So if you've completed the WLA program during this 10-year cycle, then you would not have to register for the examination. You don't need to do a computer examination if you've completed the WLA pathway.
So the registration is only for the examination. If you've done WLA, all you need to do is there a separate registration process for the submitting case list or peer
Yes.
review?
So you would have to submit the professional standing update in the case list.
And I know, but is there a deadline for that? Or that's the one, the December 1?
December 1. That's correct. December
I
1
can
is the
start
deadline.
collecting now, but
Yes, cases from January 1.
okay, thanks.
Great. Dr. Tarity.
Hello. Thank you for the talk. Very informative. Question regarding the PSU. So currently, I changed practices, different health system, and as the basically the admitting privileges and the surgical privileges, I'm at a few hospitals, but I also have consulting privileges at various satellite facilities that are under the health system umbrella. Are those reported to, like, as part of the PSU in addition, or is it just the ones where I, for instance, take call and operate consistently with block time? How should I handle those consulting only privileges, that I'm currently staffed at?
If you're on staff, you need to list them on your PSU. But if you don't do any cases, you don't have to list any cases in those facilities.
Okay, I guess the reason I'm asking is has implications for all of the the required head of surgery, head of orthopedics, head of nursing, et cetera, et cetera. So, would it just be those two facilities that you operate at would have that requirement? The consulting facilities, wouldn't have to enter additional information under those
If you're on
locations.
staff at any facility in any capacity, you need to list it on your PSU and get those chiefs' names and nurses' names and email addresses.
Even though I won't have seen a patient in that facility nor done any surgical procedures.
That's correct.
Okay.
You can understand that while for the most part that is it sounds reasonable. If, however, I was not doing any cases or surgery or seeing patients at an institution because I hadn't been asked not to, that would be information that we would want to obtain from that particular institution. Sort of the reasoning there. Dr. Eakin.
Hi, thank you, Dr. Martin, for your seminar. It was excellent. So I'm in year 7. I've done all the requirements except for the case list and PSU, and I've already come to close to 75 cases. Is there a minimum amount of follow-up that the board's wanting before I finalize the case list, or should I just go ahead and finalize once I'm done with the 75?
You can go ahead and finalize once you complete the 75 cases.
Even if the first case would have got less than 2 months follow-up?
Yes,
Okay, thanks.
you're welcome.
Great. Dr. Graves.
Sorry, can you hear me okay?
Yes, we got you.
Thank you very much for the talk. I'm in year 7 and I'm listening to the admonition to be proactive and do things now. Don't wait till year 9. And I'm going to do so based on your advice. But would that shorten the duration of my 10 years? I mean, would my new certificate then get an earlier date, or do I still get the full 10 years of mileage, so to speak?
No, you would. So what if you said, so you're 29, you
Yes,
expire at
sir.
29. Once you completed everything, you would need to complete the CME by 29, but you would go to 39.
Okay, perfect. So finishing things early doesn't change my timetables.
Right. No, that's correct. Yes. Does not change your timetable. Yeah.
Very good. Thank you, sir.
No problem. Any other questions? Dr. Muradov.
Yes, hi. Thanks for the great talk. For the case list submission, that can happen all at the same time, or does it need to happen as the cases happen? I sort of missed the boat since January, but I want to submit that this year because I also don't want to wait till the last minute to get everything done and then run out of time. So, like for example, can I start submitting the cases this year, even though I haven't submitted any of them since January, but I've obviously been doing cases?
Yes, you would go back to January 1 and start submitting your cases, the consecutive cases from January 1. So
And
that's
that
okay to,
prior to doing that, you have to pay the fee, or how does that happen? Does the fee,
you pay the
when
fee
does the fee get paid?
when you submit the PSU in the case list by
Got
December
it.
1, you pay the fee. Mhm.
Got it. Okay. And that is totally independent of the written examination that I would plan to take for adult reconstruction this year, correct? So I could do that independent of the
Yes.
sitting written exam.
Yes,
Okay.
that's
That's
correct. Yeah, we've taken apart all the 4 parts, or it's separate. You just
got
have to
it.
get them done in the 10-year process. Yeah,
All right. Thanks for clarifying that.
no problem. Dr. Dillon.
Can you hear me now?
Yes.
I think I know the answer to this, but I'm in year 7. My certificate expires December 31st, 2029. And I've already completed all of my requirements other than the PSU, the application fee, and my case list. I did get on my ABOS, it shows that I finished my lifelong learning. So, but that was all done in my first 5 years. That's not a problem for finishing in 2029.
Uh, no, if you've completed one of the knowledge assessments, and it looks like that's the ABOS WLA pathway.
Yes, sir.
So yeah, no, that's completed. That you need just one of those during the 10-year cycle.
Excellent. And so the second question is when I'm going to get all my submissions done this year, assuming that I get recertified through 2039, am I allowed to start on the CME for that next 10 years before 2030, or do I have to wait till 2030 to start submitting my CME?
You would have to wait till 2030.
Okay.
I'm looking for other people nodding, right? 2030, is that the right year? 29 to 39? Yes. Between 2030 and 2035 would be the cycle. Yes.
Excellent. Okay. Thank you.
No problem. Take care.
Sure.
Dr. Elliott.
Can you hear me?
Yes.
Okay. If you have not fulfilled your 120/20 CME self-assessment exams in your first 5 years, can you make that up in your second five or no?
Your certificate doesn't expire until 29. So yes, you can do the whole 240 by 29.
Okay, fine.
What? Yeah, that requirement kicks in 2031, though.
Okay.
So if you're 2031 or later, you get 5 in the first 5 years. I'm sorry, 120 and 20 in the first 5 years and 120 and 20 in the second 5 years.
Okay, that's what I thought. Thank you.
Any other questions? Okay, Dr. Patterson.
Hi, can you hear me okay?
Yes.
All right, thank you again for the talks. It's very helpful. I'm in year 9. I've completed all parts of my pathways except for the PSU and case list. I did the WLA pathway for part 3. I don't think I am almost certain I'm not going to hit 75 cases this year. I'm fairly certain I'll hit 35 cases because I have a mixed work schedule. But my question is, did I hear you say correctly if we completed 35 cases, but not the 75, that we would have to take the exam as well?
No, if you get to 35 between January 1 and September 30, then you do the knowledge assessment pathway of your choice.
Okay.
If you
So
don't
for
get to 35, we count back and include a full year. So we count back to October 1. If you get to 35, you choose the knowledge assessment of your choice. If you have less than 35, in that year, we have you keep counting to get to 35, and then we look at the case list. Most often, that is then, yes, this is someone who's slowing down or had some sort of life event, and that's why it's the lower number. And that person can then the credentials committee makes a decision. It says knowledge assessment pathway of choice. If there's the case list doesn't look quite right, then that would trigger further review. Either Dr. Patterson, please explain, why your case list looks the way it does, or maybe we ought to consider an oral exam or a written exam as opposed to the longitudinal assessment pathway, if that's what someone chose. So that it just triggers more review.
Okay, very good. Thank you very much.
No problem. Dr. Jadov. Hope I'm pronouncing that right.
Yeah, that's good enough. So if I've already completed the WLA pathway, now I'm submitting the case list, and by September, I finish 35 but don't reach 75. Then I just stop. Say I reached like 55, then I just stop that, and then I just finalize my case list and the professional review assessment or whatever.
Yes, that's correct.
So I don't have to do any exam because I've already done the WLA.
Right. The credentials committee reviews all that, and if everything is in order, then you would not have to do another knowledge assessment pathway. There are times when an individual has completed the web-based longitudinal assessment, and we run into issues with either problems with the case list, problems with the peer review, problems with the professional standing update, and sometimes then we will direct an individual towards an oral examination. That's
So basically,
that's rare.
So I can, like tonight, I can start putting in my case list, starting with the January 1st. It has to be consecutive cases from that. And as long as I passed 35, I really don't have to worry if I reach 75 or not. Whatever number I'm there, that is it. And I stop it at September 1st.
September 30.
30,
Yes.
okay.
Yes.
So that's it. Whatever cases I've collected, that's what it is.
Yes, that's correct.
And is there a review? I mean, do you select, like the first time when I did the ABOS, do you select 12 cases out of that? But there's no oral exam, so nothing. You just submit and it's just reviewed by the credentialing committee.
Right. We have an algorithm that looks at the case list and then we review those if there's any issues with outliers from the case list. And then there is a review of the case list and of the peer review. And if that doesn't all add up, then there are times when the credentials committee may request an oral exam. But again, those times are rare.
And when I submit case list, you showed a little slide with what
Mhm.
details you have to submit in it, like the diagnosis, the operation. Do I have to also submit my notes, the operative report or the clinic note or anything, anywhere, anytime?
No, you would just complete the case list on it's called the site is called the Scribe website. So yeah, you would not submit any other documentation.
Thank you.
Any further questions? I see no further questions. So I would just say thank you very much for your attention. If we can answer any questions, please don't hesitate to call us. We're happy to talk through the process. And if you do have questions, please call. There's no penalty for phone calls. We'd really like to help you through the process and not get close to the deadlines. It's much easier to handle questions 8 months before the deadline than it is going to be on November 30th. It's much harder to answer questions and get through issues in late November than it is right now with the deadline all the way in December. So please don't hesitate to give us a call. We thank you for your attention and have a good evening.